So a lot of leaders, they are not aware of it. So they're trying to isolate themselves in decision making and in top managerial position. So this bipolar disorder is facing a lot of challenges to them actually. So how a person can identify that he or she having a bipolar disorder, or are they affected with bipolar disorder? And actually, what is bipolar disorder? I think I'm asking this
Yeah,
question for the viewers. I think they have no
of
idea
course.
about bipolar disorder. Could you explain a
Yeah.
little bit about it?
Yeah, so bipolar disorder is actually quite different from all the others that we've been speaking about so far. Bipolar disorder is actually a what I would consider a chronic disorder. This is something that has two different states of being. Our brains go from a severe level of depression to a very high swing of mania. And how long you stay in those two spaces is completely variant among the individuals who experience this particular disorder. It has a lot to do with how our brains are processing and creating the neurotransmitters inside of our brain and how it is being to the rest of our bodies. And this particular disorder is one that is going to really make it difficult to be in many different areas of life. It's going to affect relationships, it's going to affect any job or career that you have. It's going to affect your ability to interact in society, right? Just being out in society, because where you're at, right? Whether you're in a extreme depressive disorder or moment within that disorder, or whether you're at high mania, you're going to become pretty much a completely different individual. And this is what really makes those with bipolar disorder struggle. Okay. It's really hard to be a family member or friend who has somebody who has bipolar disorder, who is unmedically managed, and they walk into the person's house and the person is having an extreme depressive moment, time period, and have to understand that this person is not going to want to go out. They're not going to want to be asked, how are you feeling? They're not going to be able to express very well how they're doing. And then when they're in the completely opposite, when they're in a mania phase, they're wanting to go out all the time. They're wanting to interact. They're wanting to do. They're very daredevilish. They're very risk oriented. They like actually can't really tell what is super risky and what's not. They just think that they're kind of invincible. And once again, with any mental health disorder, if we want to label it that, there's a spectrum. So how these two areas, the depression and the mania, is presenting with an individual is going to vary.